Chrissy, let's check back in with Upstate University Hospital infectious disease specialist Dr. Stephen Thomas, who's been looking at the virus closely for months now. Dr. Thomas, thanks for joining us once again. Appreciate it.
Hi, how are you?
Good. So we are at day 4 of this phase 1 reopening. Medically speaking, with the virus itself, has anything changed? Is it any milder, any less contagious, any more treatable? Or is this the same virus we were staring at in mid-March when it first showed up here?
Oh, it's very much the same virus, and as you mentioned, it's still here. It's still in central New York. People are still getting infected, and unfortunately, people are still dying from the infection. But what has changed is that we do have a better understanding of how we can protect ourselves and how we can protect others. We have built the capacity that we need within our healthcare infrastructure to care for both the COVID patient as well as the non-COVID patient. And there was some promising news with remdesivir, which is a drug that actually goes after the virus to stop the virus from replicating. So that has had some good data that has come out, and they've started to distribute doses of that drug to include doses of the drug to Upstate. And then the convalescent plasma, which we've been talking about for a number of weeks now, there's also encouraging information coming out of that treatment regimen as well in terms of its safety. So some things have stayed the same, but we're also getting some good news.
So with that good news, what would you say to people, and I may have seen some examples recently, I'm sure you have too, people hearing or seeing that it's time to get together. Just maybe a couple of people, not a lot. Family, friends, doesn't really matter. I'm not really particularly respecting social distancing, but I've got my mask on, I'm outside. What would you say to them?
Yeah, so this is a really challenging question because, people have been for 10 weeks, maybe even more in some cases, have been really trying to respect social distancing and physical distancing. And now with the weather getting nice and people starting to get fatigued, they're going to start interacting. And so I guess what I would tell people is, be smart, go slow, and really do not take any unnecessary risks because, as I mentioned, the virus is still circulating in the community. So what does that mean? Well, it means if you can adhere to physical distancing, then you should continue to do so. It means that if you cannot adhere to physical distancing, then you should try to continue to wear a mask. We haven't talked about it in a while, but some of those tried and true methods of washing your hands a lot. If you have to sneeze or cough, do it into your sleeve and then wash your hands. If you're sick, do not call your doctor, call your physician. Don't go into places where there are other people and you could get other folks sick. And then I guess, I would say that I think you should, before you make that decision to start socializing, you should really think carefully about who you're socializing with. This is not a time for you to go into areas with lots of strangers who you don't know if they've been adhering to the social distancing policies or not. So be smart, go slow, don't take any unnecessary risks.
You talked in the beginning, one of your first answers, about some of the good news. Well, there was news out today about an experimental vaccine against the coronavirus that's showing encouraging results in very, very early testing. What do we take away from that?
Well, I think Rick is right that it is very encouraging news, and after so many months of some bad news, I think we can be hopeful about this. Making vaccines is it's a marathon. It's not just one short sprint, and so this is the first mile, if you will, of the marathon. But it's a very, very important mile because it's when we start to demonstrate that the vaccine is safe in people. And you start with very low numbers first, and then you build up from there. The other thing that they looked at was whether or not the vaccine was generating an immune response in these people. And they checked that box as well. They were able to measure that these people were generating antibodies. And not just antibodies, they were generating antibodies that in the test tube actually kill the virus. And so that's very important. So now what they need to do is they're going to go on and do expanded studies with larger numbers of people. They're going to look at different doses. They're going to look at different groups of people. and they're going to kind of continue to march down the development pathway, and hopefully it will go. As this, as this first mile went. So I'm taking it as hopeful and good news.
Does it change your outlook at all? Because I think you have said pretty regularly 12 to 18 months for a vaccine that's available to all of us.
Right. Yeah. So, one of my mentors told me that, vaccines don't save lives. Vaccination saves lives. And so it's not just that you have to make the vaccine and prove that it's safe and has clinical benefit. You have to be able to actually manufacture the vaccine, and then you have to get the vaccine out to places where people can get vaccinated, and then people have to actually get vaccinated. So, one of the good things about the Moderna platform is that they can manufacture many doses quickly. So that's a good thing, but you still have to complete those other steps. So I'm still sticking to the 12 to 18 month time frame for it to be available at a scale which could, truly have an impact at a national level.
As usual, I have more questions, but I have run out of time. So we will welcome you back again, I'm sure, very soon. Dr. Thomas, thanks so much for joining us again. Really appreciate it.